Hello, folks. Welcome to the Silicon Valley Health Institute. We are here to bring you top grade experts from the world to give us information on how we can be well and go toward optimal health. Today, we're very honored to have Dr. Andrew Saul here. He is a pioneer and an expert in vitamins and nutrition. He's the editor-in-chief of the peer-reviewed Orthomolecular Medicine News Service. He was on the faculty of the State University of New York for 9 years and taught nutrition, health science, and cell biology. He studied in Africa and Australia, holds 3 state certificates in science education, and has twice won the New York Empire State Fellowships for teaching. A list of over 200 of his publications with online links to most of them can be found at dryourself.com publications. He was inducted into the Orthomolecular Medicine Hall of Fame in 2013 and has been named one of 7 natural health pioneers by Psychology Today. He is the author, co-author, or editor of 25 books, 4 written with Abraham Hoffer, MD. He's featured in the movie Food Matters and that vitamin movie. His free access peer-reviewed website is dryourself.com. Welcome, Dr. Saul.
Well, thank you. It's a pleasure to be with you today. Would you like me to begin?
Please.
All right. I think it's a good time to talk about censorship. There's a lot of people who are out there and they don't know there is any because it's working. And the funny thing about censorship is that because it works, people don't know they're being censored. And the people who know it works are the ones who are being censored. So in the immortal words of Alan Alda or somebody out of a war movie, actually it's Alan Arkin, wasn't it, from Catch-22. The whole thing is a little bit crazy and you have to be crazy to understand it. Well, for those of us that are very concerned about censorship, we want to share our own experiences. You probably had some of your own. This is what started it all. I made this statement over a year ago, and it was simply that the coronavirus pandemic can be dramatically slowed or stopped by the immediate widespread use of high doses of vitamin C. Now, this was picked up by the mainstream media, and they just trashed it. They took that sentence and they ripped it 6 ways from Tuesday, but they paid no attention whatsoever to the 2 sentences that followed right behind it. And that was that medical doctors have been using vitamin C in high doses as an antiviral for 75 years. And that we have a very long track record of success, clinical success, against serious viral illness using large doses of C. And that's what I based my statement on. And this is what happened to that statement. Facebook put the infamous gray screen on it and then called it false information and then said it was checked by independent fact checkers. They were a little slow. 48,000 people read it before Zuckerberg did. But sooner or later, and by sooner or later, I mean 2 days later, on February 14th, Valentine's Day, the World Health Organization actually met with Facebook, Amazon, Google, YouTube, and the others, and said they want to put a stop to this infodemic, this misinformation about coronavirus. And one of the things on their list is the heretical suggestion that high doses of vitamin C are a good way to prevent or treat COVID. Funny thing was, at that exact moment, at Zhuanghen Hospital in Wuhan, yes, that's Wuhan, the epicenter of all of this, they were already giving 24,000 milligrams of vitamin C intravenously to their COVID patients. Now, I am in personal communication with the head of the emergency service there, the critical care service, and also in direct communication with a hospital in Shanghai. And we found it very interesting. So we decided we would share this. And here's an exact quote from Zhayong Peng, who is chief of critical care at Zhuanghen Hospital, Wuhan University. Now, I'd like to point out 2 things. Zhuanghen Hospital is huge, and Zhayong Peng has credentials as long as your arm. This man is not just a senior physician, he's chief of the entire service there. So this is a physician with tremendous credential power. And he said, in my department and other hospitals, we highly recommend that patients use 12,000 milligrams to 24,000 milligrams a day of vitamin C. That works for a significant reduction of COVID becoming severe. Well, that's the whole point. You don't want people in critical care. You want to keep them out of critical care. So you give them the vitamin C so they won't end up there. And if they are there, then of course, it's all the more important they get it, because the next step could be the morgue. Now, he took this one notch further. In my hospital, all the medical professionals are given vitamin C powder to take 1,000 to 2,000 milligrams. And it was his contention, and I have every reason to believe him in, that the majority of the major hospitals in Wuhan are in fact giving vitamin C powder to the medical professionals. Somehow this escaped notice by the mainstream media. Even this escaped notice by the mainstream media. Days later, 50 tons, that's 2 large semi-trailer truckloads of vitamin C, had been trucked into Wuhan specifically to fight COVID. People wanted proof. There it is. We've got the picture. There are the trucks. And what's really neat about this is who provided it. The vitamin C was provided free by Dutch State Mines, DSM, one of the largest vitamin C manufacturers in the world, and they're based in the Netherlands, but their plants are primarily in China. China makes vitamin C for less money than anybody else. That's why 90% or more of the vitamin C on the market is from China, which came in really handy when we needed it most. So it was basically just a matter of a truck ride away to bring in 50 tons of vitamin C to Wuhan. Now, another university hospital reported that, now we're on February 20th now, we're still in the first week or two of this. Another 4 patients with severe new coronavirus pneumonia, see, they don't even call it COVID-19, that's how long ago this was, how early, recovered from this ward in Tongji Hospital. High-dose vitamin C achieved good results in clinical applications, and they said vitamin C treatment should be initiated as soon as possible after admission. High-dose vitamin C can not only improve antiviral levels, but more importantly, can prevent and treat acute lung injury and acute respiratory distress. This is very important because COVID per se doesn't kill people. Many people are exposed to COVID and don't even have any symptoms. They don't even appear to be sick. We don't even know that they've got it. We don't know how many people are running around with COVID because they weren't tested, because they're healthy. Then there's people who have the virus and they have some symptoms. They have a mild flu or cold. Then quite a few people have a nasty flu, and they're down and out for 3 days to 2 weeks, depending, and they're sick as a dog, and we all know what that's like. Influenza is a miserable thing, and it's no joke. But the people we're worried about are the ones that are at risk of dying. And when they are at risk of dying, it's usually from severe acute respiratory distress or acute respiratory distress, ARDS or SARS, you call it what you want to, or pneumonia. This is what people are dying from. So the government of Shanghai, China, actually decided that they would recommend giving vitamin C for COVID, 200 milligrams of vitamin C intravenously per kilogram body weight per day. And that works out to be around 16,000 milligrams a day by IV. I thought this was important. Indeed, the Chinese Medical Association published this recommendation in the Chinese Journal of Infectious Diseases, which is their equivalent to JAMA. There's the reference, there's the pages, there's the DOI, there it is. You can check it in Chinese. We've taken and translated it into English, so you don't even have to, but even Google Translate will do it just fine. There it is for the world to see. So this seemed newsworthy. Oh, no, you don't. Some fact checkers who possibly had a high school education said, no, the Shanghai government has not recommended intravenous vitamin C. Yes, they have. Because I was talking with a physician, Dr. Richard Cheng, who's actually a Chinese American from Carolina. Dr. Cheng was over in Shanghai visiting his family when COVID hit and he couldn't come home. So he made good use of his time. As long as he was in Shanghai, Dr. Cheng decided to talk to the other doctors and the hospitals and the government officials. And he pointed out to them that vitamin C was very valuable in fighting viruses. And he had the evidence and the experience to back it. Well, Facebook said I was lying. And Science Feedback, whoever they are, said that I was lying. And more to the point, they're saying that Dr. Cheng and Dr. Peng and Dr. Mao are lying, and not once did a news media or Facebook or a fact checker consult me or Peng or Mao or Cheng. They never checked it. They simply said it was false. Now that's censorship in the good old fashioned Nazi style. So by withholding this information from the public, we're withholding it from the patient. And that means people are dying unnecessarily. Make no mistake about it. I am not a COVID denier. I think there is a COVID virus. I think it's very serious. I think it's no joke. But I also think that we have an immune system, and that is really the only game in town. We have an experimental vaccine, which isn't even a vaccine, which is badly tested, if tested at all. It doesn't prevent transmission. It doesn't guarantee it's going to work. We have other measures, masking, distancing. These things have terrible economic consequences, not to mention psychological consequences and even physical consequences for the elderly, for children, and for everyone in between. So by not telling the public, there's no demand for patients to get it. So the patients die and the public doesn't even know it. Curiously, just a couple of weeks later, The Lancet had an article where they pointed out the treatment for severe acute respiratory distress syndrome from COVID, not just SARS in general, but COVID SARS. Rescue therapy with high dose vitamin C can also be considered. You would think something in Lancet would get recognition. Lancet's a pretty good journal. Physicians in South Korea petitioned the president for the use of vitamin C for COVID-19. There's the petition. You can take a look at it. Korea had a severe outbreak. I happen to be in direct personal correspondence with a medical doctor who ran a small private hospital right at the middle of where the outbreak occurred in Korea. He gave vitamin C to all his staff, and vitamin D is in Doug, and gave it to all the patients, and nobody got COVID. And they were right in the middle of it. And these were people that were already in for flu-like symptoms. The UK Daily Star reported just a few days later, hospitals are treating coronavirus patients with vitamin C. Doctors say it helps. It could help turn the tide. Well, that's exactly what I said 5 weeks earlier. Did they say the Star was wrong? Well, nobody's come out and say they were right. Harry Himala is one of the great vitamin C researchers on Earth right now. He's at the University of Helsinki, and he is very highly regarded. And he is really, by all measures, a very conservative writer, a very careful researcher, and he does a lot of careful statistical work. And Himala set things straight by saying that, first of all, it's not going to do any harm. High doses of vitamin C don't hurt people. And the idea that they do has been found to be unfounded. And then he puts in the one that I particularly enjoyed seeing, the statement, it's been stated that patients with pneumonia can take up to 100 grams, 100,000 milligrams of C a day without developing diarrhea, possibly because of the changes in vitamin C metabolism caused by the infection. This is called bowel tolerance, by the way, and these are oral doses. People want to know how much vitamin C to take, and the answer is it depends who you are and how sick you are. So Dr. Robert Fulton Cathcart of California years ago found that he could give patients that had viruses 100,000 milligrams of C a day, sometimes more than that, and they wouldn't have loose stool. You got to ask yourself a question, where's it going? So the dry sponge holds more milk argument comes to mind. Now, most people, if you were to give them at once 10 or 15,000 milligrams of vitamin C, they'd be running for the toilet pretty quickly. They'd have what Linus Pauling called loose stool, or they'd have a lot of gas, a lot of flatulence. Some people say diarrhea, but it isn't diarrhea. Nobody wants diarrhea. Linus Pauling specified loose stool, and so did Cathcart. So you have this interesting non-technical way of determining dose. You take enough C to be symptom-free, whatever the amount might be. I've been saying that now for 46 years. My students got tired of hearing it a long time ago. My children probably did too. But guess what vitamin they give my grandchildren? Well, I'm still wrong. But now they say it's partly false. Now, here is a statement that I didn't even make. And they're saying that this doctor in Scottsdale, Arizona, was giving people false information. You try to find his YouTube video now and you won't. YouTube, by their own admission, and this was weeks ago, admitted they had taken down 200,000 videos. If that's not censorship, I don't know what it is. And now PolitiFact, whoever they are, says no, vitamin C cannot slow or stop the spread of coronavirus. This is in direct opposition to what was being done in China and reported in the UK and elsewhere. Now here's Dr. Engqing Mao, Chief of Emergency Medicine at Ruijin Hospital, Shanghai. He treated about 50 people with moderate to severe cases of COVID. That's moderate to severe COVID. He gave them intravenous vitamin C, 10,000 milligrams a day for moderate cases, 20,000 milligrams for the severe cases. Keep in mind that vitamin C given intravenously is approximately 10 times more effective than orally. Obviously, the absorption with an IV is 100%. I get that 10% figure from Dr. Atsuya Nagasawa, professor of medicine and president of the Japanese College of Intravenous Therapy. He's also the president of the International Society for Orthomolecular Medicine. So when you see 20,000 IV, think 200,000 orally, and we're right back to what Cathcart was given. Isn't that interesting? And that wonderful observation, all patients who received IV vitamin C improved, and there was no mortality. Nobody died with moderate to severe COVID. There were no side effects reported. And I got this once again directly from Shanghai by Dr. Richard Cheng. And this is what Facebook did to that one. Now you might be wondering why I'm picking on Facebook, but I wonder why Facebook is picking on vitamin C. I'm using Facebook as an illustration because they're big. The same with YouTube, the same with Google. But the fact is the censorship has permeated the social media, and it doesn't take any thought at all to realize that the mainstream media is easy to censor since they get all their money from advertisers. Who does the most advertising on television? Might be the pharmaceutical companies. Who's the #1 lobbyist in Washington? It is the pharmaceutical companies. At his own homepage, Mark Zuckerberg says that Facebook gives people the power to share and makes the world more open and connected. God bless him. That's a wonderful statement, and that's what we need more of. But I don't understand why Facebook would block reports from licensed physicians. It's one thing to tell someone that Andrew Saul, because he's not a physician, has nothing to say about this. All right, I could accept that. I'm a teacher. My background is, I used to say, is in education, not medication. But to shut up licensed medical doctors is really extreme. For those who think this never happened, here is a screenshot. There is the date, Valentine's Day 2020. CNBC reported it. It's still on the internet. You can find it. There was what can only be described as a conspiracy to stop people sharing information that the World Health Organization disagrees with. And it was Dr. Anthony Fauci, of all people, who made this lovely statement in the Washingtonian magazine in 2016. There's the link. Dr. Fauci, who for some reason has neglected to tell the American public to take vitamin C to increase their immune strength, himself takes vitamin C to increase his immune strength. He takes 1,000 milligrams a day, he said in the article. 1,000 milligrams a day, Dr. Fauci takes the vitamin C. That is 11 times the US RDA. Why is the RDA okay for everyone else, but Dr. Fauci takes 11 times it? Is there something he knows that he's not telling us? And why isn't he letting us discuss it? In China, it's been on television. I don't mean everyone in China agrees. There's some physicians in China who don't think it's a good idea. But oddly enough, there is less censorship of vitamin C therapy in China than there is in the United States of America. And this is so far from the way I was raised as a little boy in school in the early 1960s that I don't even have words to express my concern for that one. So Dr. Cheng started posting videos. Remember, he's in Shanghai. He's close to it in Shanghai, pretty close to Wuhan, relatively speaking. And he put up an interview where he interviewed a Wuhan family, and YouTube took it down because he pointed out that the family took a lot of vitamin C and none of them got COVID, even though the grandmother lived with them and was hospitalized for severe COVID and went into intensive care. Dr. Cheng was quite surprised. Now, we need to establish that there's no argument that vitamin C is beneficial in fighting illness. This is in every nutrition textbook ever written. I have taught clinical nutrition. I've taught cell biology. I have taught the sciences. I've taught every grade from first grade through postdoc. And no matter where you look in nutrition textbooks, vitamin C is specified as essential for the immune system to work properly. The argument is over to what extent is it beneficial, and this, of course, is dependent on dose. Moderate amounts of vitamin C can prevent, and large quantities are therapeutic. The New York Post is one of the largest newspapers in the United States. I think it's the fourth or even third largest paper in America. Remember now, we're way back to March 2020, only 6 weeks after I pointed out that vitamin C might have some value. We find out that I was not alone in that conclusion. The UK Daily Mail also had a story. Now, you might not like everything you read in the Daily Mail or the New York Post, but they are legitimate sources of opinion. And there's the man, Dr. Andrew Weber, a board-certified pulmonologist affiliated with 2 Northwell healthcare facilities on Long Island. Now let's talk about Northwell. Northwell is the largest healthcare provider in New York State. Now that is a very significant background to what I'm going to say next. They were using vitamin C, and not very much, but his intensive care patients would immediately receive 1,500 milligrams of vitamin C. Some actually got 3,000 milligrams. And the amount that they would give would be as much as 6,000 milligrams a day. But I got inside information from a nurse in his unit that they couldn't give 6,000 because they couldn't get enough of it. So they're giving most of the patients about 3,000 milligrams a day. Dr. Weber says the patients who received C did significantly better than those who did not get it. It helps a tremendous amount, but it's not highlighted because it's not a sexy drug. Have you seen anything from Dr. Andrew Weber about treating COVID in the last many months? Have you seen that lovely smile on this young physician? Has he been on any talk show? Has he been on TV, in the magazines, in the newspapers? And yet the New York Post thought enough of it, and Weber thought enough of it to go on record and tell us about it. Good for him. There was a time when this was funny. So in my opinion, we already have a vaccine for COVID. It's oral vitamin C. I think the public knows this. When I put the information out on the studies in China, in 24 hours, I had 1.2 million views of that statement, which does explain why Facebook lowered the boom on it. Anything with that kind of attention gets attention from others as well. And vitamin C immediately sold out worldwide. For a while, you couldn't find it anywhere. And I was getting reports from Africa, from Britain, from Europe, from Australia, New Zealand, you name it. I was getting reports that nobody could find vitamin C. It sold out immediately. I think that indicates that people are taking it. And I think that's how we're going to get our herd immunity. Now, I am being simplistic, but I can only say that because my understanding of biology, which has been my life's work, is that your immune system is better than a drug and better than a vaccine. We talk about the virus mutating, there can be new strains of it, but we forget that our immune system can keep up with that arms race. We've been doing this for millions of years. That's why we're still here. Vitamin C therapy goes way back. And here's some names that you may not be familiar with. I've already referred to Dr. Cathcart. Well, let's just take a quick look and see where I'm coming from. Full professor of bacteriology, Klaus Washington Jungblut was at Columbia Medical School, and he did the first work on vitamin C against viruses. And I want you to note the date. Jungblut showed that it was preventive and a therapeutic option for polio and published in 1935. Inactivation of poliovirus by crystalline vitamin C in the Journal of Experimental Medicine. The Journal of Experimental Medicine is open access. You can get all these papers on the internet without paying for them. Then he published additional papers on vitamin C to prevent and treat polio in 1937, in 1937 again, in 1937 again, in 1939. And at this time, we had a president in the White House who had been partially paralyzed with polio. How ironic that the interest in vitamin C then vanished. Even though on September 18th, 1939, Time magazine did a feature story on research against polio and pointed out that Jungblut had shown that low vitamin C was associated with the disease. That was in Time magazine. Now, Jungblut did not give very high doses of vitamin C. In fact, he gave very low doses, and still it worked. So he made this statement. That's what I based my statement on. I used to tell my students, I'm not smart enough to make this up, but I have learned to find doctors that cure disease and copy them. If you want to learn more about Klaus Washington Jungblut, I did a short biography of him, and it's available at my website, dryourself.com. Dryourself.com is non-commercial. I have no connection whatsoever with the health products industry. I have no connection whatsoever with the supplement industry. There are no Andrew Saul vitamins for sale. If you go to my website, I don't even sell my own books at my website. It's completely free and non-commercial, and it is peer-reviewed. Another physician that we can thank for his work on vitamin C was Toronto-based William J. McCormick. He was one of the very first to advocate gram-sized doses, meaning 1,000, maybe 2,000 milligram doses of vitamin C. This is considerably more than Jungblut, and he noticed that it worked better. To learn more about Dr. McCormick, again at drself.com, I have a bio that I wrote of him, and we even have some pictures that his family provided, which was kind of nice, so you can get to know this physician. If you've ever been to Toronto, you might know where Bloor Street is. And his spa, he ran a health spa, was actually out in what was at the time practically a suburb of Toronto. Now, of course, Toronto has grown considerably. Then we have Frederick Robert Quanner of Reidsville, North Carolina. Quanner was a board-certified chest physician, Duke University Medical School graduate. And now we're getting not to 1,000 or 2,000 milligrams per person per day, but around 1,000 milligrams per kilogram body weight per day. So we have a major jump here in vitamin C consumption or administration. 350 to 1,200 milligrams per kilogram body weight per day is a lot of vitamin C. Quanner would usually give it by injection. And again, by injection, it works the best. He treated polio, pneumonia, and other serious viral diseases, and with great success. He could reverse viral pneumonia in 72 hours, and he wrote about this. He published about 20 papers in peer-reviewed journals. And there's a bio of Dr. Quanner. His protocols were summarized by London Smith, the pediatrician known nationally as the children's doctor. London Smith was one of the most frequent guests ever on The Tonight Show with Johnny Carson, by the way. Even Linus Pauling didn't win Emmy Awards, London Smith did. So London Smith did a wonderful job of publicizing Quanner's work, and the book that he wrote, a 68-page book, is available free of charge, and you can download it from this and other locations on the internet. It is really interesting. One day after teaching a clinical nutrition class, one of my students came up to me and placed it in my hand and said, "You have to read this." I thank that student to this day. He was right. And there's a full bibliography as well as a biography of Dr. Quanner's work, again at drself.com. Mentioned earlier, Dr. Cathcart had experience with the highest doses that most of us have ever even heard of. And ultimately, as the years went by, he would not only treat acute hepatitis as well as influenza and pneumonia, but even AIDS. AIDS patients predictably took massive amounts of vitamin C, and he noticed that the symptoms went down and they lived a lot longer. This did not see the light of day either. This was censored even back then. I have repeatedly tried to do a presentation on Cathcart's work and present it to AIDS advocacy groups, and I have never been accepted. It has never been permitted. I don't understand that. One would think a serious disease needs all of the effective remedies against it that are possible, and discussion would be welcome. Censorship is not new. Here is the best single paper by Cathcart where he explains bowel tolerance. It's again very, very simple. You take enough C to be symptom-free, but not so much as causes loose stool. This varies from person to person. It varies in the same person from day to day. People that are well don't hold much C. People that are sick can hold a mind-numbing amount. When I had viral pneumonia years ago, I took 2,000 milligrams of C every 6 minutes I was awake. That's 20,000 milligrams an hour. I was coughing like crazy and I had a high fever. I was playing Scrabble with my wife, by the way, and I lined up the tablets, 1,000 milligrams, 2 by 2 by 2, big pitcher of water, a glass, and a timer. I took 2,000 milligrams every 6 minutes, In 3 hours, my fever came down 3 degrees and my cough stopped. And to give you an idea how serious the cough was, the internist had given me a codeine cough medicine. Didn't need it. Cathcart made this statement, which I think is very important. He had never seen any flu yet that was not cured or markedly ameliorated by massive doses of C. And once again, this went into my statement in February 2020. But Facebook censored it. Not only do they say that they don't agree, they're actually saying it's false information. Now, I would like to know how the opinion of a medical professional can be considered false information. The man has 35 years of experience treating patients with high doses of C, and he draws a conclusion. How can that be called false? To learn more about Dr. Cathcart, I have his full bibliography posted at dryourself.com. Bob was a very interesting person. He told me years ago, don't even waste your time trying to get this into the mass media or into the medical journals. He said, go on the internet and take it directly to the people. And that's, of course, what we're doing right now, all of us. Many people will agree that vitamins are good. Many people will agree that there's something to it, but more research is needed, but we definitely don't have anything to go on. Now, when that's a vaccination, we don't even stop to hiccup. The fact that the vaccination is unproven has nothing to do with it. We'll make everybody have it, or at least try to get everybody to have it. So vitamin C, which is safe, is not good because it's unproven, but the vaccination for COVID is okay, even though it's unproven. And since it's unproven, we need to take it. I don't want to be part of that experiment. Hegel embarrassed everyone when he said, what we learn from history is that we do not learn from history. This always gets a smile when I show it in a presentation, but it's a knowing smile. Because when we see that, we think, yeah, that's us. Or as Mark Twain said, life is just one damn thing after another. You can pick whatever one you want to use. Back to Harry Hemela again, and I want to emphasize Hemela's objectivity and his credentials and his skill as a statistician. He found that 17,000 milligrams of vitamin C given by IV shortened intensive care unit stay by 44%. Now, for starters, think of the money savings here. We'll just start with that. Then we can consider the value of making those beds available to someone else who needs them. Then we can think about the reduction in deaths. Then we can think about the reductions in pain and suffering. And when we do this, we realize that vitamin C is everybody's best friend. For those who have a difficult time handling Cathcart-like doses, these 100, 200 gram doses, I would like to now bring us to studies that have shown that even small amounts of vitamin C can keep severely ill patients from dying. And Hunt and colleagues published on this in 1994, and Shiguang and others published on it earlier, even back in 1978. And Kahn and others published on it more recently. And basically what they found is that with children, even 200 milligrams of vitamin C a day reduced the duration of severe pneumonia, and oxygen saturation was improved in less than a day. Now, if you're a parent or a grandparent, your worst nightmare is that your child will be in the hospital with pneumonia, and that oxygen level will go down, and they will be in danger of their very lives. When children go into the hospital for pneumonia, it's not a drill. So if we can give them a small amount of vitamin C and reduce the duration of their stay and improve their oxygen saturation, that means we're going to save pain and suffering and lives. But this information is not getting out. Dr. Atsuya Nagasawa, who I mentioned earlier, said that the Japanese College of Intervenous Therapy recommends to its members to carry extra vitamin C and give between 12,000 and 25,000 milligrams of vitamin C intravenously for acute viral infection, administering it once or twice a day for 2 to 5 continuous days. And yet, Dr. Quenner observed decades ago that some physicians would stand by and see their patients die rather than use vitamin C. And then he added that extra one: vitamin C should be given to the patient while the doctors are thinking about what might be wrong with them. And I always thought that was particularly nice. We can all agree that the greatest danger with coronavirus is pneumonia or severe acute respiratory syndrome. And here's a very interesting report from 1946. I live in Rochester, New York, which is only an hour and a half or so away from Buffalo. So I thought it was neat to find that vitamin C had been used routinely by the surgeons at Millard Fillmore Hospital in Buffalo as a preventive against pneumonia, with complete disappearance of this complication. I'm going to restate this. For children, only 200 milligrams a day reduces the duration of severe pneumonia and improves oxygen saturation in less than a day. You know, if there was a drug that did that, it would be in the news. But it's also good for the elderly. And with COVID, they are much more at risk. So vitamin C given to the elderly resulted in improvement in respiratory symptoms in the most severely ill hospitalized patients. Look at this now. An 80% reduction in deaths in the vitamin C group on 200 milligrams of C a day. The RDA is 90. We're talking half of a big box discount store vitamin C tablet that costs approximately 3 cents. And for that, we can cut down the number of elderly patients with severe respiratory problems in hospitals. We can cut the death rate by 80% for 3 or 4 cents a day. Many people, when they see this, think, you know, if this were so good, the doctors would already be doing it. But that's just not the way it is. Quite frankly, a lot of doctors don't know this. Most medical doctors go to medical school, they study medicine. It's funded by pharmaceutical companies largely, certainly the research is. They prescribe medicines, they get a medical degree, they're medical doctors. Now you put the word nutrition in there or vitamin and you see how funny it sounds. My doctor went to vitamin school and studied vitamins, prescribes vitamins. You just don't hear that. My mentor, Dr. Abram Hoffer, put it very bluntly when he said, the worst thing that can happen to critics of orthomolecular medicine is that they will never, ever use it. And the US Army had a nice epigram from the World War II years: learn and live. If you don't, you won't. You can subscribe to our orthomolecular medicine news service free of charge. We have about 28,000 subscribers. There's no advertising, it's non-commercial. The archive is available as well for free access at the same address. The orthomolecular medicine news service has been published continually for 17 years. It is sent to all the major media. Once in a great while, a major outlet will pick us up. For instance, the Chicago Tribune picked up one of our articles a few years ago, so we know it's getting to them. But unfortunately, getting to them isn't the same as getting to the readership. that concludes the presentation that I have on COVID and censorship.
We have quite a few questions that have been entered since you started your presentation, and I'd also like to invite everybody now to raise your hand if you'd like to ask a question directly. The hand raising feature is in your reactions button at the bottom of your screen if you're using the web client. If you're doing it on a phone, I really don't know what to tell you. Have you looked into the role of vitamin C on redox reparation of oxidized glutathione?
I personally I have not. Remember, I'm not a researcher, I'm not a physician, but I hang around with a lot of people who are. And they have told me that glutathione, vitamin E, selenium, vitamin C, they all play well together. And generally, it's the weakest link. So if you have someone that's really sick, the reason we focus on vitamin C is because you can put it in immediately. It's inexpensive, it's safe, it's well tested. We've got 75 years experience with it. But we know that the other nutrients are important as well. We'd like to get a more broad approach, but I would like to start by stopping people from dying that are in intensive care. And although glutathione has great value, when someone is at risk of their very life, what they need is vitamin C first. Let's get them back on the regular ward, then we'll give them some glutathione.
We have a very, very basic question here about ascorbic acid versus salts and the ion, and is it necessary to take the whole vitamin C molecule? So I think that's just basic orientation towards the terminology.
It could be that, or it could be based on a misconception that ascorbic acid is somehow not vitamin C. And I make a certain amount of upset people when I tell you this, but there is no vitamin C complex. Vitamin C is ascorbic acid, C6H8O6. And if you want to check my work, you can take it up with the Almighty. You can go to nature and see that most animals make their own vitamin C, and that's what they make. So how can it not be natural? Fleas, rats, mice, dogs, cows, pigs, horses, alligators, they all make their own vitamin C. They make ascorbic acid. Ascorbic acid is, for most people, the best way to take it. Some people that have very sensitive stomachs do well taking a salt of ascorbic acid, such as sodium ascorbate. Linus Pauling made mention of this quite often because it's pH neutral. They can also take calcium ascorbate or magnesium ascorbate, but clinically it seems to not work as well. Sodium ascorbate's your best bet, and it's only slightly more expensive than ascorbic acid, and ascorbic acid is cheap. One of the reasons perhaps it's not promoted more. Linus Pauling also said that you can take vitamin C as ascorbic acid powder, put it in a little bit of water or juice, and add a 1/4 teaspoon of sodium bicarbonate to buffer it. And this is for people that complain about the acidity. But we need to point out that the acidity of ascorbic acid is almost exactly the same as that of a cola drink or cranberry juice or orange juice. So it is greatly exaggerated that ascorbic acid is somehow a problem. I would not soak my dentures in it overnight if I had dentures, and I would not recommend that you brush your teeth with ascorbic acid. For that, that would be just wrong. You'd be exposing your teeth to unnecessary acids. But if you are taking a tablet, there's no exposure at all because it goes down first. And if you're drinking it in juice, what I would do with my children is I would just have them rinse their mouth when they're done with water or juice that did not have seen.
I have a question about this issue with the long hauler symptoms, lingering symptoms with COVID. And I remember that Klenner did some work with, or maybe somebody that was one of his colleagues or associates did some work with people who had partial paralysis from polio, where the paralysis was resolved late in the disease process rather than by concurrent administration. Mm-hmm. Do you have anybody who has talked about the use of vitamin C for long haul COVID?
The doctors that I work seem to feel that it's important for people to keep taking it, but they would need less with time. I don't think I'm qualified to give a really thorough answer there, but what I would do is send us back to Dr. Quinter. He wrote a protocol for multiple sclerosis and related illnesses that I think gives some insight into how he feels other vitamins work for the benefit of the patient and specifically for the nerves. And that protocol is at drself.com for a free download, thanks to the Townsend Letter for Doctors, so let me put it up there. So I would go and read over what Connor said. My father told me as a boy, Andrew, if you want a good answer, ask the organ grinder, not the monkey.
Do you know what happened between the FDA and other government agencies and the manufacturers of intravenous vitamin C solutions?
Not as much as most people feel has happened. Anything that's going to be injected, I think, is rightfully the province of the FDA to regulate as a drug. I don't have any problem at all with FDA regulating injectable vitamin C. For a while, and I've talked to people who are involved in this very deeply and operate clinics using IVC, for a while it was difficult for them to get enough vitamin C, but I think it's because the demand went up, not because the supply went down. Remember, vitamin C tablets sold out almost worldwide. Even I had to wait 6 weeks for an order once, and I know where to get it. So you can understand that the acceptance by the public of vitamin C has been very, very high, even though the mass media has discouraged it, if anything. The vitamin C IV solution can be made up by a physician in their own office, and I have instructions on exactly how to do that at drself.com. written by Dr. Robert F. Cathcart himself. And Bob let me put that up, and I have a note there. This is for physicians, not for the general public. I don't think people should be doing that. I think doctors should be doing that. So if it's an availability issue, physicians can make up their own injectable C by following that protocol. If they can't get injectable at all, you can use oral doses. One of the reasons we advocate IV vitamin C is for the very sickest people that are in danger of dying, that are in critical care. They're already lying down, they already can't eat, they already have tubes in them. Let's just patch in some vitamin C and save their life. For people that are ambulatory, for people that are home, for people that are outpatients, for people that are not nearly as sick, they can take tablets. The sicker they are, the more likely you want to use IV vitamin C. By the way, there isn't any monopoly on making vitamin C because 90% of the vitamin C comes from China. And if China shuts down exporting vitamin C, they will be really doing themselves a disservice economically because they're going to lose their market. And I don't think any country or any business is going to do that. So I think it's an unnecessary concern. People worry that the government's going to take our vitamin C away from us. That's not happening. In the same way, they're not going to burn the books either. They just make them hard to find. They make the information hard to locate. With vitamin C, they make it difficult for you to learn about it. Shall I read that question and answer it?
Any question you want to read and answer is fine. I'm just scanning through them, and oh, we have a question. We have somebody, Gregory.
Yeah, thanks so much for your presentation and doing so much great work on this stuff. So I know a few, I'm a PhD student at the University of Washington, and I know several misinformation, disinformation researchers, and they're really good people, and they really care about all this stuff. And I'm just curious, what, if any, dialogue has been like between, people that have been being censored unfairly like this and those types of researchers, and if anyone like you or other people would be interested in getting into conversation with some of those people.
Anytime, anywhere. What normally happens in a case like this is that the good people are told by someone higher up that they'd better not. And this happened to Cathcart a lot. It's happened to me a lot. It's happened to a number of people who would like to discuss this, and then the rules are changed and the event is canceled. Harvard, for instance, recently actually canceled a writer who was going to talk about how there was censorship, and Harvard canceled the appearance. So we have, unfortunately, a problem where person to person, I'm convinced that the people who are not in favor of vitamin C therapy simply don't know enough about it. And I think it's true with race and gender and culture as well. I didn't learn anything until, as an 18-year-old college student, I spent a year overseas. And then the following year, I spent a summer in West Africa. And I've never been the same since. And I'm sure a lot of us have had this experience. You know, when you go to Africa, you have what you think is culture shock. Oh no, it's when you come back from Africa that you have culture shock. And it never leaves you. It never leaves you. And once you know, you can't not know. And I think Dr. Hugh Reardon, one of my other mentors for that, Hugh founded the Reardon Clinic in Wichita, Kansas, which is arguably the world's top vitamin C research installation now. Hugh pointed out that once you know, you can't not know. Another good example is Victor Marcio Vega. Victor Marcio Vega is in San Juan, Puerto Rico. He is a radiation oncologist, conventionally trained in every way. And he gives high doses of vitamin C. And he also does radiation therapy. And he said, once you start using the vitamin C, you never go back because it works so well that all of a sudden you have patients that are getting better quicker or getting better that wouldn't have gotten better. And he saw improvement, and he saw it, and he uses the C, and he sees improvement every day. And I said to him one day, Victor, so at the university, how do they receive you? Anybody argued with you? And he said, only for the last 25 years. And he said, but that's okay, because that was me back then. So his view is we keep doing it, we keep helping patients, and the word gets out. And I will talk to anyone, anywhere, anytime that wants to take a look at the work of Quenner and Cathcart and Jungblut and the others, because these physicians spent their entire life carefully researching this. The very first course I taught was in 1976, and it was called Forgotten Research in Medicine. And now it's the year 2021, and I'm doing the very same thing. I think it's absolutely incredible how we keep running around in circles trying to reinvent the wheel.
Gregory, let me also add that my suggestion is that if you do introduce your friends and associates or in this kind of a field, that you caution them not to mention it to their employers and their bosses.
I can tell you from experience how difficult this can be. I had an undergraduate student, she was a junior, and she became acquainted with the work of Jungblut and polio and these other studies, the Quenner and such. And she said to me privately, I'd like to do a paper on this. And I said, well, if you're going to do a college level paper on this, you're going to have to really be careful that you reference this properly. And you look, and she said, all right, I'm willing to do that. Can I find enough to support it? And I said, you can probably find 20 good supporting references to make your case. And I think for an undergrad paper, that's not too bad. So she went ahead, and another faculty member told me that she had submitted this paper and he just trashed it. And he described the student as a dial tone. And I was so appalled, because here this student had taken the time to check and read the literature, and the faculty member who was grading it apparently hadn't. So this can be a real problem. You can lose your job over this. Doctors are losing their medical licenses over this. I know a physician in Louisiana who's at risk of losing his or her license. There's a physician well, I'm not even sure I should give the state, but the doctors are out there And they have been told they're not to talk about this. They're to take it down from their websites. They're not to use it in their practice. So I'm now publishing their case histories under pseudonyms. If you go to the Orthomolecular News Service archive at the address I have on the screen, if you can see that, orthomolecular.org, we have a paper by presentation by Dr. X and another one by Dr. Y. And these are actual brief case histories. Dr. X had 25 patients. They all got 25,000 milligrams of C for 3 days. All COVID patients, all confirmed, all better in 3 days. Now that's at least interesting.
What are your thoughts about liposomal vitamin C?
Liposomal vitamin C has merit. I think it's way too expensive. It's running about $1 a gram. Whereas if you go to a big box department store, you can get a gram of C for 6 cents. My concern is that people will think that it's 18 times more effective and they won't take as much. And I don't think that's accurate. So although it has value, I think the price makes it a distraction. People that are involved in selling a product often have a very different approach to it than I do, because I don't have any product affiliation at all. I make a lot of people upset when I say this, but I don't care what vitamin C you take. I care that you're well. You take enough C to be symptom-free and you're done. Whatever kind you want to take. If you have money for designer vitamin Cs, be my guest. But for the majority of people worldwide who cannot possibly afford liposomal vitamin C, we've got to get them having the cheapest vitamin C we can find. And one of the marketing issues is that in promoting one product, they sometimes disparage another. And this is a serious mistake. Any form of vitamin C is good. I have never met a wild animal yet that manufactures liposomal vitamin C.
How much vitamin C do you take on a daily basis, and what do you recommend for a normal, healthy adult?
I take between 4,000 and 18,000 milligrams a day preventively, depending on my own perception of how I am feeling. I know that's very subjective, but it is my body, and I think I have a handle on what works for me. So normally what I tell people is do what monkeys do. Monkeys cannot make their own vitamin C. Primates can't. Neither can guinea pigs, for example. So a study was done looking at 25-pound monkeys, and they took a real careful look at what they ate all day. There's a fun job. I used to tell my students, that's why you stay in school and get your degree, because you get to get a job like that. So they're watching the monkeys, and they notice that they're eating a lot of fruit, and a lot of the fruit they're eating is overripe, fallen fruit. And if you think about it from the monkey's point of view, that's a lot less work than having to go up and climb and get it, and safer too. So monkeys were eating a very large amount of fruit that was pretty high in vitamin C, and it worked out to be about 600 milligrams a day for a 25-pound monkey. Now let's multiply that by 10, and that's 6,000 milligrams for a 250-pound man. So we're looking at around 4,000 or 5,000 milligrams a day as a monkey optimal amount. Gorillas were studied way back by Geoffrey Bourne back in 1949, and he found that gorillas consumed about that amount, about 4,500 milligrams of C a day. So this has been confirmed over the decades. And Linus Pauling and Erwin Stone took a look at this across the entire animal kingdom and found that animals manufacture vitamin C to the tune of 2,000 to 10,000 milligrams of vitamin C per day per human body weight equivalent. And it's remarkably consistent through the animal kingdom. So I would say if you have 1,000 milligrams with each meal and maybe a little extra, that's a good preventive dose. The RDA is 90. And this is a fun fact. Not everybody knows this, but the United States Department of Agriculture has standards for how you feed laboratory animals. Now, if you're a biologist, this will ring true with you right away. If you keep animals, if you keep guinea pigs or monkeys or any other kind of lab animal, you have to keep them well. And that's one of your obligations. And there are standards for monkeys and guinea pigs. And per pound equivalency with humans, they are taking in 15 times more vitamin C, because the USRDA requires 15 times more C for a guinea pig or a monkey per pound than it does for your child.
We have somebody here who wants to pursue a nutrition degree, and with a view towards furthering research and awareness in this area. Where would you suggest they study?
That's a tough one. Ideally, I'd like to send them on to medical school, but something happens between that first year of medicine and that last year of residency. And I think big pharma kind of beats the idealism right out of somebody. As their debt goes up, their open-mindedness goes down. And I've heard this from lawyer candidates as well as doctor candidates. I taught at a chiropractic college for a while. I taught clinical nutrition. I'm not a chiropractor. I would say chiropractic is good because you'll get more nutrition education than you will in medical school. Even back in the early 90s, we required 2 full courses of nutrition of our chiropractic students, and there were only a small number of medical schools that required a single full course. Even better would be go to a school and become a doctor of naturopathic medicine. There are not that many schools of naturopathic medicine in the United States. There's at least one in Canada. That would be an excellent choice. If you become a dietitian or a nutritionist through conventional education, they probably will dissuade you from any use of megavitamins. Anything that we've been talking about today will be considered heresy. The other thing you can do is simply learn it on your own. But I caution people to beware of online marketed schools that are really not offering you anything more than you could do yourself. You can't use a credential unless it's from a fully accredited institution. So if you want to get a job where you can help people with nutrition, I would say it's chiropractic college or naturopathic medical school.
Okay, I'm scanning for a question that I supposedly missed earlier.
Well, there was one about a form of powder.
There's
Perhaps
also
it
one
was
about
a
the
fruit
shelf
powder?
life of vitamin C. Yeah.
Shelf life. The shelf life of vitamin C, dry ascorbic acid, is years. I don't even know if you could easily measure it. If it gets wet, if it goes into solution, it's more prone to oxidation. If you have vitamin C powder capped up, I think it would keep for a very long time. I don't know how many years, but it's quite stable. When vitamin C goes into solution, it's going to mix with the oxygen that's in the solution. You can prevent that from being a potency problem by just adding more vitamin C. So if you want to make up a vitamin C to drink through the day, you just add a little extra to allow for that oxidation. Or you can do what the food manufacturers will tell you at their normal sites. They will tell you to use an acidic solution. So vitamin C in orange juice will actually hold better because the orange juice is slightly acidic. Did I answer that question?
Yes. Yes. And it's also the case that if you boil water, you drive all the oxygen out of it. Or if you bubble some kind of a gas that doesn't have oxygen through the water, you will also drive out the oxygen. But it is true. That's why sodium ascorbate doesn't have as long a shelf life as ascorbic acid does, because of the pH issue.
Right. And you can buy calcium ascorbate powder and you can actually see it discolor. Calcium ascorbate powder will start to yellow over time.
Yeah.
And over time, I mean several years. But I've had ascorbic acid. It's been part of the life of my family for quite a long time. And I've never seen ascorbic acid change color, but then I've always kept it capped up. And that would be my recommendation. One other thing is keep it out of the refrigerator, because they say store in a cool, dry place, but a refrigerator is a cold, wet place. And
Yeah,
when
I
you
froze
take the
some.
bottle out, you get condensation.
Yeah, I had some frozen for about 9 years that I had triple bagged up. And it was crystalline white at the end of that time. So it was no problem at all.
Right. The issue is really moisture and oxidation.
Exactly. And so if you're going to keep it in a refrigerator or a freezer, make sure that it warms up to room temperature before you open the package.
There was a question about whole quality vitamin C. I think I've answered that, but I'll say it again if I didn't annoy people the first time through. Vitamin C is ascorbic acid. It is C6H8O6. That is the law of physics. That is the way it's made in the body. That's the way the molecules line up. That's the way the atoms connect. You can take C6H8O6 and make it another way, and it's also an antioxidant, which is used in industry, but it's not a vitamin. When people buy vitamin C, they are buying ascorbic acid. Vitamin C is tested by any legitimate supplement manufacturer. They all test the products they take in. So you have to rely on the people you're buying from to do that testing. The FDA would be down their throat if they didn't. So there's a very strong incentive for food supplement manufacturers to test the product that they sell to you. And if you've heard on the media that the FDA does not regulate supplements, that is absolutely false. Go to the FDA's own website. At the top of the supplement page, in the first paragraph, it says, FDA regulates vitamin supplements, food supplements, but they're regulated differently than drugs because they are different than drugs. FDA is the Food and Drug Administration. They regulate foods and drugs. Vitamins are sort of between the two, but they lean a little more to the food side. And they are regulated, but they are regulated differently than drugs. The FDA approved Vioxx, and Vioxx killed a lot of people. The FDA also regulates vitamins, and the American Association of Poison Control Centers has been tracking who dies from what for 37 years now. We've looked at the data, and there are a total of 14 allegations of deaths from vitamins in 37 years through the entire United States. When we took a close look, we found none of those reports were substantial.
I did find a question here. Somebody was in the ER last week for chest pain and had a D-dimer reading that was very, very high. And so it's supposedly related to blood clot risk. Now I have what feels like wet lung. And they did not do a COVID test in the ER. They didn't even scope me, do a chest x-ray, et cetera. What can help my dry lungs? What's the best supplement for blood clotting?
I think we're extending past the reasonable limits of what I can answer in this particular seminar. Mm-hmm. That's a question for a physician, but I would invite you to read up on it, and that's what dryourself.com is for, and I remind you it's peer-reviewed. We have articles there on this type of issue, and I think that Dr. Quenner's statement, give vitamin C while the doctors are pondering the diagnosis, might apply here. So I'm going to send you home with homework. And if you go to dryourself.com and do a search, I think you will find information on this.
Okay, we've got Muriel. Can you unmute yourself?
Yes, sorry, I had to step away for a second. Presumably China then isn't interested in any of the COVID vaccines. Is there any coverage of this? And earlier, Gregory Nelson suggests that there is a Sinovac. If so, why?
I am not an expert on vaccination, and I cannot tell you what I don't know. Will Rogers said we're all ignorant, just on different topics. So when it comes to vaccination, I am simply like everyone else. I am cautious. And I'm looking at it very simply, that if vitamin C is safe and effective and we have it now, we should use it. And as far as vaccination goes, that's another question. What I tell people is if you are forced or coerced into having the vaccination, go ahead and do it, but take a lot of vitamin C when you take any vaccination. One of the dangers with the COVID vaccination, so dangerous that the package insert from the manufacturer states this, is anaphylactic shock. So you have to be watched for 15 minutes to half an hour with emergency equipment present when you get a COVID vaccination. And anaphylactic shock is serious, it's fatal. Well, vitamin C seems to help prevent that. Dr. Archie Kalakaranos wrote a very interesting book on this called Every Second Child years ago. He used to vaccinate Aboriginal children, and the mothers would hide the babies from him because half of them were dying after the shot. Kalakaranos worked for the Australian government, and this became a real painful experience for him because the idea that he was hurting these children, killing these children, really, really disturbed him. So he looked into it and came to the conclusion that a lot of them didn't have enough vitamin C. They were scorbutic. So when he started giving them vitamin C supplements, they didn't die anymore. And that book is Every Second Child. It is out of print, but you can obtain it in an electronic copy for free from the Soil and Health Library in Tasmania, Australia. Now, I know that sounds obscure, but if you do a search on the internet, you'll find it right away. They'll ask for a donation, but you don't have to give them one. So it's called Every Second Child. And this explores the safety of vaccinations increasing when people have more vitamin C. So I would urge everybody, whether they get the shot or not, to take vitamin C. But certainly if you have the shot, that's all the more reason to take it.
So,
Gregory, you're up next.
oh, is there a Sinovax?
I don't know.
Okay.
Yes, and China is not monolithic. I'm sure there's vaccine research going on there, just like there is everywhere else. Gregory?
Yeah, I'm curious what the, so I mean, I've looked through this research for a long time, for many hours, and I'm just really curious, like, and the research seems really strong. Do people like study the adoption? Like, has anyone actually like seen like how often are people using vitamin C? How is this word of mouth spread among different doctors and patients and treatment communities? I know that you can probably upper bound adoption through just the production of vitamin C across the world. I don't know if there's other uses for vitamin C, maybe in food packaging, other things like that, that would kind of complicate that computation. But I'm just kind of really curious about that. Yeah.
I am too. I think it would make an excellent PhD project. And I'd like to sit on that committee. May I add that when we take a look at vitamin C consumption, we do know a couple of things, broadly speaking. And one is that after Linus Pauling published his book, Vitamin C and the Common Cold in 1970, the sales of vitamin C went up. We have a public that is quite capable when they hear that vitamin C intravenously is effective against severe COVID and being used that way in China and by Northwell hospital systems in Long Island. For seriously ill, intensive care, critical care patients at risk of dying, that vitamin C saves their lives. The public is quite capable of taking, let's see, IVC for critical care, oral vitamin C for prevention. And the public not only is capable of doing that, that's exactly what they have done. So my understanding is that vitamin C sales are up 2 or 3-fold already around the world. If you're having trouble finding it on the shelves, you can confirm this. I think it's easier to get it than it was about 6 months ago. So are people taking vitamins? It's generally accepted in the United States that at least 2/3 of all Americans take vitamin supplements. And it has also been estimated that 3/4 of doctors take vitamin supplements. I think that's encouraging. I'd like to see it verified, but that's the word that you will find more often than not.
Yeah, I saw this at an Orthomolecular Medical Society meeting where somebody in the stage asked the question, how many of you recommend vitamins for your patients? And maybe 5% of the hands went up. And then how many of you take vitamins? And it's like 70% of the hands went up. But I also would like to point out that we've asked this question of several vitamin C practicing doctors about their transition into vitamin C. And basically it's that they try it and it works so well that they never go back. And that's the pattern that I've had in conversations with people. Even Bob Cathcart said that exact same thing.
Yes, you know, it's a beautiful thing to track this. A good example is Dr. Lyndon H. Smith. Dr. Smith in 1969 wrote a book where he mentioned vitamin C 3 times, and all of his comments were more or less negative. 15 years later, Dr. Lyndon Smith was recommending 10,000 milligrams a day for children. I think it's wonderful when people can learn and turn around. And when physicians do that, they get hammered. A doctor told me years ago, Andrew, you're lucky. You don't have a license to lose.
Yes. John.
Andrew, thank you for your great talk. My understanding is that we are one tiny enzyme away from producing our own vitamin C. And that's something we share with guinea pig and some apes. But what I also understand is that enzyme is in our genes, is in our DNA, but non-expressed. What is your idea on that? Why is it we don't express something that is that vital? And
Well,
it's, it's something I'm bugging around.
It's a very good question. Since ascorbic acid is C6H8O6, and it's made from glucose, which is C6H12O6, you have to knock off 4 hydrogens and do a little furniture arranging. It takes 4 enzymes to do that, and we have 3 of them. So that strongly implies that at some point, somewhere in the past, we could do this. Erwin Stone, an industrial biochemist who got Linus Pauling interested in vitamin C, by the way, in the beginning, Erwin Stone hypothesized that there was some kind of genetic mutation and we don't have that 4th enzyme, which I think is L-gulanolactone oxidase. I used to say to my students, now there's something to tell your parents when they ask you, what did you learn in school today? So we don't have that enzyme. And as you say, do we have the basic mechanism to express it? Stone would say, we just don't need to anymore because like those monkeys, we ate a lot of fruit. Guinea pigs have to have fruit. And oddly enough, fruit bats can't make their own vitamin C. Now, if a fruit bat can't make its own vitamin C, that's a window into understanding this. And I think that people that say to me, well, can't I just take that enzyme and make my own C? And I say, well, why don't you just take the C? It's cheaper and easier. For whatever reason, natural selection seems to have favored Homo sapiens ascorbicus.
Okay.
Yeah, there's a common genetic ancestor between all the primary hominids and that chimpanzees, gorillas, and humans all lost the ability to make vitamin C at a common point before we separated our species. And the hypothesis is that at that time, we were living in a tropical jungle where fruit was everywhere. Doug.
Yeah, my question is absorption of vitamin C. Is it recommended to take vitamin C on an empty stomach? Should you take it with food? Does it make any difference? What's the best way to take it? If you have to take it with food, is a certain type of food better than another type of food to take it with? And my other question is, I'd like to know more about Stephen Folks, who's kind of the co-host of this thing. Very knowledgeable guy, obviously. I don't know much about you. I'd like to hear more about you, actually.
Well, I'll answer your question to me, and then Stephen can try to worm his way out of the question you gave him. With vitamin C, how you take it is strictly a matter of comfort and effectiveness. If you take a lot of vitamin C at once on an empty stomach, you are likely to have immediate bowel tolerance. And I tell people, well, don't do that. Divide the dose out through the day. Since vitamin C is water soluble, dividing the dose is probably the key thing to know about it. If you take a lot of C at breakfast, most of it will be gone by mid-afternoon, probably even sooner. So dividing the dose means you're going to have more bang for the buck. And vitamin C and the B complex, for that matter, should be taken in small, widely divided doses. If somebody is having trouble taking vitamin C because of gastric distress, or they can feel the tablet, and some people can, and if you're taking a lot when you're sick, a lot of people can, have it with food. Have it with a buffer, such as some calcium supplement or magnesium supplement. Have it with liquid. Have it with a snack. Have it with a meal. And that will reduce that because you're going to have automatic buffering there. Or you can buy buffered vitamin C. Repeating what I said earlier, sodium ascorbate is pH neutral, and there's also calcium, magnesium ascorbates, which are not as effective and more expensive. So it's a matter of comfort and what works for you. There's no wrong way to do it unless you are either sick because you took too little, or you're having a toilet shattering catastrophe because you took too much.
There is one thing that I do recommend that people pay attention to, and that is when you're getting timed release vitamin C, that in a tablet form, this is how they do it, snap the tablet in half and taste the inner surface. If it's acidic, get your money back. It should be neutral for your intestinal and bowel pH management.
And while we're on the subject of time release, the idea is excellent, but it doesn't always pan out well, especially for elderly people, because they are less likely to break down that time release or sustained release tablet. I think frequent manual doses are best, and Linus Pauling felt that frequent doses of powder in juice are best. But the ultimate test is what works for you. Everybody wants to know, how much vitamin C do I need to take? And the answer is, I don't know, but you can find out. So it's experiential. I have taught this to little children. 8-year-olds get this. They don't want to take their vitamin C, but if you tell them, well, look, you're not going to go out and play with your friends if you're sick on Friday, forget about Saturday, they will immediately get to bowel tolerance on Thursday to go to school on Friday, to be well on Saturday. An 8-year-old can do that. My grandson, when he was 5 years old, was feeling poorly one day, and unbeknownst to his mother, absconded with the vitamin C chewables. He wasn't feeling very well, so he took them to his room, played quietly. And of course, when children are playing quietly, you tend to forget that they're in the house. And there he was taking his C. He came back a few hours later. He had gotten a bowel tolerance. He put the vitamin C back on the counter, and he was 5. Now, you might think that's bad parenting, but it's not, because by teaching children, we are making them people and not patients. And we're starting a whole new trend in medicine here. I raised my kids all the way into college, and they never had a single dose of any antibiotic, not once, not ever. They never met their pediatrician. Once we were driving down a main road in Rochester, New York, and my daughter looked out the window and said, "Isn't that our doctor's office?" And they'd never been there. Now, we had pediatricians, we would have gone if we needed to. The trick is not to avoid physicians. The trick is not need to go. And this is why a knowledge of nutrition is so valuable. The safety margin with vitamins is extraordinary. So I remind everybody, you take what works for you. I don't care what form, I don't care what amount. As long as you're well, you're doing it right. You don't mess with what's working. But if you have complaints, if you have allergies, if you have difficulties, it's time to re-examine your dosage and try a therapeutic trial. Taking more C can make the difference.
What about people with oxalate issues? Can you review that topic?
Yeah, this is pretty important. The first thing we need to understand is that vitamin C does increase oxalate excretion. It simply does. But I don't see any warning labels on chocolate. And chocolate also increases oxalate excretion, and there's a number of vegetables that do as well. Secondly, Dr. Emanuel Cheraskin, one of my mentors, professor of medicine at the University of Birmingham Medical School, said that vitamin C actually blocks the connection between calcium and oxalate. Vitamin C blocks that bonding. So people who take more vitamin C may have more oxalate, and it doesn't matter because it's not going to connect with the calcium because the C stops it from doing so. Now, this can be verified by Dr. Robert Cathcart. Remember him, the one who gave up to 200,000 milligrams of C for decades? Cathcart wrote, and he said, by the time I heard that vitamin C could cause an oxalate kidney stone, I had amassed clinical evidence that it couldn't. So in all of these years of giving huge doses, he had 2 patients that developed an oxalate kidney stone, and both of them had reduced their vitamin C level. And I thought that was just particularly charming. So the idea that vitamin C causes an oxalate stone is simply not true. It's basically a Loch Ness Monster legend. Until somebody lands Nessie in a net, I'm not going to buy it. And until they show me a vitamin C caused oxalate kidney stone, I'm not going to buy it. Increased oxalate production is normal, and that oxalate production increase, actually, even when it goes up, is still within the normal range of human beings. So it's a non-issue.
Oh, wait a minute. There we go. I'll give some stuff about myself at the very end once we've stopped the recording. Admin?
Hi, okay, sorry, I couldn't change my name. I no
Yeah,
longer see
I
an
blocked it.
option.
Yeah.
Yeah, I no longer see an option to change my name. So I'm sorry, the questions I asked still haven't quite been answered. I do want a specific comment on the powders that we buy that say, you know, like someone else asked, amla powder, rose hips, camu camu. When we buy these food sourced vitamin C in the powder form, are those going to sort of have less shelf life, or we have to be very careful with the temperature with them, or any of those things? Thank you.
It's a good question. And you're onto it. The shelf life of ascorbic acid, pure ascorbic acid, is the highest, the longest of any form of vitamin C. So if you want shelf life, you buy ascorbic acid and then you put it in your fruit juice, or you have it with your fruit salad, and that way you're getting the fruit factors. When people buy vitamin C from these so-called food sources, their intent is to try to get something better than ascorbic acid. And in my opinion, they are misled. I think they are deliberately misled. One example of the misleading problem here is that if you actually contact the manufacturers in writing, ask them, is all of the vitamin C label promise in this product entirely derived from, and then you list those foods. I know one company that's been making so-called natural food source vitamin C for longer than almost any other, and I read the label and it had 100 milligrams of ascorbic acid in it. Now, this is a company with a tremendously good record, and they're a good company. But what happens is what's called whole food vitamins is often a tablet matrix of whole food containing laboratory-made vitamins. And I don't think people should pay high prices for ascorbic acid in a food base. I think they should get cheap ascorbic acid and eat the foods. But the only way to know this is to go directly to the manufacturer. Don't ask the salesperson. Don't ask the people that are talking about it. You have to go right to the manufacturer and put that question to them. I ask them, may I please have a full label disclosure of every product you make? It's rare to get that, but once I did, 18 pages, single space, they told me absolutely everything that was in absolutely every tablet, and I respect that. But usually you get a letter that says, well, we can't really do that, it's proprietary, but we can assure you that our products are made to the highest standards, our reputation is very good, and we're as natural as possible. To me, that's baloney. That's like buying a car from a used car dealer at night and they say, yep, this will really go. That's not enough. I think you have to have it checked over by your mechanic before you sign on the dotted line. So I have a very, very cautious view. I have high trust of manufacturers, but I don't have the confidence that people who are making money selling them have that high standard. So consider the source.
Why is vitamin C often paired with bioflavonoids?
Because bioflavonoids are found in foods that contain vitamin C, and they work together very naturally, very well. The white stuff in an orange, that there's a lot of bioflavonoids in that. Should people eat bioflavonoids? Yes, but if you buy vitamin C with bioflavonoids, there's only a few milligrams of bioflavonoids in there, and the tablet might cost considerably more. So once again, if you buy cheap C and eat your fruits and vegetables, you'll have more at the end of the day than if you buy designer C and don't eat all those fruits and vegetables. So I suggest you put your money into food and you buy cheap ascorbic acid. But if you have the money and you don't want to, you buy any product you like.
Susan, do you have some questions that I missed?
Let me look.
Ah, here's one. Joseph asked, is there any information about vitamin C for people with cardiovascular disease?
Yes. And for that, I would send you to the dryourself.com website and the books by Dr. Abram Hoffer. It's a big question. We also have a book called The Orthomolecular Treatment of Chronic Disease. It's an 800-page, very large, big, heavy book that's fun to drop on your doctor's desk when they say, I have not seen any evidence that vitamins cure anything. The Orthomolecular Treatment of Chronic Disease has a very good section, a long section on cardiovascular disease and its treatment with nutrients.
Karen asks, if you're in the hospital with COVID, can you ask to get a vitamin C IV treatment?
Yes. You can also ask for anything else if you like. You have a snowball's chance in Hades of getting it, but you can ask. Now, to help you with this, I have a paper I wrote called How to Get Vitamin C IV Administered to a Hospitalized Patient, and it's at dryourself.com, and you can download that there. It's basically negotiation skills and playing the hospital game. Dr. Thomas Levy has a very dim view on this. He's a cardiologist and an attorney, and he says, don't hesitate, tell them they give you that or they get sued. In almost every state, possibly every state, it is entirely legal for a doctor or hospital to give the patient what they ask for. So you got to get the patient to ask. Problem is, if the patient's in a coma or is very sick or they just feel horrible, they're not able to be their own advocate. So you've got to be there as a family member or friend. Problem is, with COVID, they're trying to keep people away from these patients. And I think that's very, very dangerous for children and deadly for the elderly. I cannot begin to express my concern about how we've isolated the elderly and let them die without even have the one thing that's the most important for a person in a nursing home, which is visitors. If it were a jail, we'd think it was cruel, but with old people, we don't even bat an eyelash. This has got to stop. So I diverged there a little bit, but I'm not going to leave without saying that. With vitamin C, you can keep them from having to be in the hospital at all. And ultimately, that's the power move. The only way to win is not to play. And you have to recognize that when people go in hospitals, their choices are going to be limited. And they're going to try to tell you what they're going to do. And the only way around that is to go nose to nose and say, this is what you are going to do. This is what we want. I want 6,000 milligrams of vitamin C by IV every 12 hours, and don't change that unless you get a written authorization from me. I will sign any paper you have taking responsibility for this. I will absolve you from any malpractice claims. If you don't do this, I will be on the news tonight. I will have an attorney in here and I will raise all kinds of trouble. Are you sure you want to do that? Or would you like to just give the vitamin C? If they try to take your vitamins away from you, you pick up the phone and dial 911. And you tell them that you're going to put a 1 on that if they don't put your property back, because you're going to report theft. Now you have to play hardball here, because if you don't, somebody's going to die. I have no mercy for a system that institutionalizes pain and suffering. Life is hard enough without withholding from people something as simple and safe as vitamin therapy. I'm getting tired.
All right. I'd like to join Susan and thank you for a brilliant presentation and for your entire career in supporting all this.
Well, you're
Yes.
very kind.
And I hope that people spread the word and spread this. We've given a namby-pamby title because we're trying to minimize censorship. So that's why the title doesn't say what this is about, but spread the word, get it out there, because there's a strong force against trying to get this information out. And this is life-saving.
And remember what Albert Schweitzer said, Nobel Prize winning physician, said, not only is example the best way to teach, it is the only way to teach. So if you do this, if you walk the walk, people will notice. You can influence your family by doing it. You might have trouble getting your 3-year-old or your teenager or your spouse or anybody to do this. But if you do it, and if it works for you, you're making the strongest statement you can. So we lead by example. Will Rogers said, men's minds are not changed by argument, but rather by observation.
Yeah, and if you want to be observed, it's better if you don't argue first.
I agree with that.
Also, when getting into a discussion with somebody, I find it's best to go to their frame of reference and talk to from them. Everybody's in a different planet and we have to go to their planet to get their attention. Otherwise the barriers go up. Sometimes if we just kind of love what they say or think what they say is wonderful, it might change the energy so that, you know, whatever subtle unseen things going on that might dissolve that. And we have to keep getting the word out because something ain't right.
What you said is absolutely beautiful. That is good advice. We meet people where they are. And at this point, oddly enough, it's the word of Fred Rogers that really connect with me. Years ago, I was teaching at 2 state penitentiaries. And I was dealing with prisoners, one in a women's prison, one in the men's prison. And I was finding that certain things worked better in terms of relating to them and teaching them. And I wrote Fred Rogers a letter, and to my astonishment, he answered it. A full-page, single-space, typed, personally signed letter. And I told him in my letter that I found that what he taught children was working really well with prisoners. And I thought this seemed a little odd. And he wrote back, oh, no, it's not. He said, that's the whole point. And it was so encouraging to me that you meet them where they are. And he legitimized everything. Remember, the sick people that you're dealing with, in fact, the public in general, are terrified. They are crippled by fear. And you start there. And the message is, yes, you are afraid. Remember what Fred did. He always legitimized how a child felt. You can feel that. That feeling is okay. Let's talk about our feelings. Your feelings are fine. You're fine just the way you are. Yes, I used to feel that way too. You know what I did when I felt that way? I did this. And it was, what do you do with the mad that you feel? Wonderful teaching. So what I say to everyone now in this COVID epidemic is, what do you do with the fear that you feel?
Great question.
So thank you. Please spread the word one-on-one because it's just so important that we wake a lot of people up who are buying and believing everything on the social media and in the doctor's offices.